Thank you very much for the invitation, Carl, Jerry. And I was told two things. Look back, I wanted to look forward, but I've been told to look back. And then the next thing that was terrible for me is do not use slides. So could you please take the slide out? This was an order, it was not suggested. Okay. If we're going to look back, I want to go back 30 years, not only 20 years. 30 years ago, Jerry and I were part of a new initiative. And I want to mention only one name, Ken Warren. Ken Warren was one of the first persons that decided to utilize modern biomedical research to address the problems of developing countries. And he started the Great Neglected Diseases of Mankind network. Jerry and I were part of that network. 10 years later, we had the report. What were the expectations of the report? Let me recall three phrases. First, improvements in human welfare in the coming years will be enormous. Second, and I'm quoting the report, a large share of the current burden of disease, perhaps as much as 1/4, will be prevented. And then the very end of the report is like the end of a children's tale. And people around the world, especially the more than 1 billion people now living in poverty, will live longer, healthier, and more productive lives. What's the situation 20 years later? I'm quoting WHO 1 or 2 years ago. In global health, we're witnessing the benefits of new medicines and technologies. Cancer, AIDS, and cardiovascular problems are becoming chronic, treatable diseases. But there are unprecedented reversals. Life expectancies have collapsed in some of the poorest countries to half the level of the richest. So as Jerry, we've been involved for more than 30 years in this business of promoting health research in poor countries. And I want to share with you the next 8 minutes a few problems. Probably the main problem has already been mentioned by Jerry. We need more knowledge, as simple as that. We need more knowledge in terms of policies, we need more knowledge in terms of health infrastructure, biomedical research, etc., etc. But I have prepared a list of problems. The first problem, which is never acknowledged because it's not correct politically, is bureaucracy. And I think that's a major problem. Bureaucracy at international agencies, at regional agencies, bureaucracy at local agencies, both in rich and in poor countries. So, what can be done? Reduce waste and efficiency. Choose experts. Please choose experts, not bureaucrats. And promote research champions. I've heard for 20 years, 30 years, the phrase capacity building. What we need is motivation building. We need really people that are motivated about what they are doing. And not what happened during many of the meetings. The main issue of the meeting was where is the next meeting going to be held? Not what was the problem to be addressed. I'm exaggerating, but just a little bit, not too much. The next problem is investment fragmentation. We have too many initiatives, there's lack of coordination, many people have addressed to this. Other problem is the fact that some diseases have become fashionable and others not. It's not fashionable to address the problem of diarrhea, of respiratory infections, maternal mortality. We know what the fashionable diseases are. Even the neglected diseases are now fashionable. It's fashionable to speak about neglected diseases. Now there are 17 diseases that have been chosen by WHO to become fashionable neglected diseases, but there are many more. And what we need probably is a holistic approach to public health perspective. Not only addressing categories, infectious or non-infectious, but addressing health as a single problem. Problem number 3, or C, and again, I think this is important and it's seldomly mentioned. Uncontrolled human growth. The fact is that we're interested in the health of poor countries. The fact is that day by day, hour by hour, by the hour, day by day, we have more poor people in the world. And demography is a key component if we are going to address the problem of health in developing countries. This is exceedingly important, and normally this is not taken into consideration. So we need the science of demography, we need the science, we need education, it's basic, and we also have to raise at least 2 comments on the negative or positive impact of religions on the increase of the human population. But this is never addressed because, again, it may be politically not correct. The next problem is the responsibility. Who's responsible for health promotion? It's obviously the governments, but it's also at the local level, it's a workplace, and it's also the individual. It's probably time to make the different levels responsible for promoting health. Not only talking about governments, but also the different levels, and I don't have time to go into the detail. Problem E, private financing. It's welcome. I mean, the billionaires have decided to put some money into health research. That's good. But one problem is that the more money they put, the less governments in poor countries put money for research. Let me give you an example from my own country, Mexico. There's one research agency that has an endowment of $1 billion just for health research. And the problem is that this agency pays for most of the most expensive equipment for the National Institute of Health. And the government always, when they are asked, we need such and such instrument that costs $1 or $2 million, go to that agency because they pay for that. So that is really a problem. The more money we get from the billionaires, the less money we get from the governments. And finally, as a biomedical scientist, I have to confess the failure so far of biomedicine to really promote health research. Let me quote the man who was responsible for the Human Genome Project and who is the director of the NIH. And I quote, "It is fair to say that health of most individuals has not yet been properly affected or improved by molecular biology. It's been 10 years since the genome of the Anopheles mosquito was sequenced. It's been 10 years since the genome of the Plasmodium, the parasite that produces malaria, has been sequenced. We don't have new vaccines, we don't have new drugs. Why it is so slow, this process? Probably not only investment, but also addressing the process of producing knowledge. Why is it so slow? I think it's as important as the importance that money may have in improving health. Thank you very much.